Hey guys, it's Dr. Emer, and we're back from the OR and doing our filler Friday today with one of our already amazing looking patients who wants a little more male facial sculpting. And I love when you can look at a client and we can identify areas we can get enhancement. We don't need perfection, we don't need plastic, we just want natural and enhanced. So here's the thing, look at his face, higher cheekbones already, a really nice sort of squared lower face. He works out, so he has a little temple hollowing. So one of the things we want to do for just anti-aging purposes is do a little temple filling, and then on his face, give him sculpting. We're gonna do a little bit lateral lifting to the cheek. Now in men, we go a little bit more in the superior direction and then lateral direction, and a little bit horizontal rather than inferior. And I'll show you guys that in a second. We're gonna build out his master, already has a nice jawline, just make it a little bit bigger. But the greatest thing I think will be balancing out his nose, lip, chin ratio by projecting this and widening it. So it's gonna look great. We're gonna use mainly Radius, which is a calcium-based filler. And a lot of people ask, little pinch, can you do fillers if you have a beard, right, Jordan?
Yes, we had that
They ask
yesterday.
that all the time. Here's an example, you guys. Yes, you can. It's obviously a little bit harder to see, but again, you wanna enhance the person's facial shape in their natural state. So don't make anyone shave, let them, keep their beard the way it is so that we can, treat it as how they're gonna see themselves all the time. What are they saying on there? All right.
There's a lot of people joining in right now. Let's see who's here.
So tell them as we're going.
People recognize me now.
I always know they love you. So you guys know there's numbing inside here, and we also do topical. The thing about the numbing here is that he will feel a little numbness around the mouth. And again, so if we draw a line kind of coming down, he does a good job with his shaving. We're gonna go right to that lateral edge. It's gonna feel a little weird. And widen it. So we just widen the chin a little bit. Look, about finger breadth in width.
How long are these fillers gonna last him?
You guys know, tell them. This is Radius.
Guys, it's gonna be 12 to 18 months for your results.
Exactly. And what happens with Radius that's different than the hyaluronic fillers, Radius, Belladonna, and Sculptra, they all build collagen, you guys. So Radius builds a little bit of collagen, which is why I actually like it, but it's also meant to be deeper injection. Although when we first started, years and years ago, we were using Radius for folds and wrinkles, which you still can. It's actually FDA approved for that.
Right. Any words of wisdom for a nurse who wants to become an injector?
Go slow, take your time, and learn from experts, you guys. If you're gonna do it, you gotta take your time and learn from an expert, because anatomy is key. Fillers look like they're easy, but they're not. And they can have side effects and consequences if not done properly. So, take a look. I just really like the structure that he has. And I really want to build this out because I think this is going to be a big impact for him. Excellent. This is going to really define as we do. Sometimes we'll do a little bit into the superior part. We call this the lower cutaneous lip. Women will call it the marionette area. Guys tend to not get as much drooping there at an early age. He's super young. So that is the chin right there. I think that's a nice chin improvement.
There you guys can see the widening, a little bit of projection there.
And he just looks bold, right? It's a bold, masculine look. So now we're going to go to the masseter, our jawline, angle the jaw. And look, he already has, look up with your chin a little bit. Follow that jawline. His bone comes down a little bit further because he's got a strong muscle. So we're just going to identify that 90-degree angle. And we're just going to do a teeny bit right at that 90-degree. Remember, we don't want him to look overdone, just enhance. So this is a good starting point. Show him back, look straight ahead. I'm going to move to the other side now. You know, feel like nowadays you can like really, now take a look now. Look at already on this side. See that chiseling that he has now? It's also defined from the way that he does his beard, but the width is there. We now have that more of that 90 degree, and that little bit of that hollowing in the center makes him look just super masculine. What else are they saying? So now I'm gonna turn you this way. What else are they saying there?
All right, do you have a pain level for our patient? Thumbs up, thumbs down. No, he can't talk while we're doing the masseter.
He actually looks like he's doing great. I think you would know if he was in a lot of pain.
Okay, someone's probably watched us a bit. How long between chin, jawline lipo, and fillers does Dr. Emer recommend?
Well, that's actually a really good question. You can do chin filler the same day you do neck filler, actually. But for jawline, if you're going to do the jawline filler, do it 4 to 6 weeks after you've done the neck lipo. So that's half and half. I'm going to do a little in the temple, let that settle a second.
If you guys want to see some neck lipo and Renuvion, we did that last night. It's on our IGTV.
Ooh, is our patient coming today?
She will be here
Oh,
today.
I can't wait to see her. So this already looks great. So I'm going to start now in the temple. The temple is an area I always tell people, weird feeling. A little bit of crunchy that you hear, a little bit of bubbly that you hear because it goes all the way down to the bone. And this supplies volume here. You don't, with him, I don't want to overdo it because he naturally is leaner, so it's actually good. Like, but look at the difference already. You don't want it to look too artificial. So you want it to be a small amount to just kind of fill it out. Say, now that was the deeper part of the temple. Now we're going to go up to the more superficial part of the temple. Again, kind of feels weird. This will actually support the eyebrow. In women, you can do it in a certain angle to lift the brow. In men, we don't really want, I mean, we'll do it, but we don't really want too much of a lateral lift in the men. Perfect, got it. Because you don't want them to look feminine. What else are they saying there?
Someone said it's a big difference. They can see it already on him.
Oh yeah. It's gonna be really good because it's just gonna look better, but he's not gonna, like, no one's gonna look at him. Temples that actually made a really big difference, if you guys can see. The outside was a little more hollow than the other. Do
Wow.
you chew on your right side? Yeah, so some people have temple hollowing more on one side from chewing. Some people actually have it larger because they chew so hard that the muscle grows.
That was the same on our live from yesterday with our patient that we did who had amazing jawline results.
Oh yeah, he did. Some people will do what's called aspiration. I'll show you guys that here, where you pull back to see if there's any bleeding, but or you're in any blood vessels. It's very rare in this location. It is common though. You can see right here the veins to kind of pop out a little bit. Yeah, the patient from yesterday, I want to see follow-up from him. I want to see a testimonial and a follow-up because he is going to look great. People were already like hitting on him on Instagram DMs. They were asking for his Instagram. I'm like, I can't give that to you. Okay, so over here we don't need as much. We're just going to do a teeny bit in the upper portion, and I'll do a little more. Also, this will always look a little more full for a week or two, and then it settles in. And now we're going to go back to the jaw.
How are you feeling right now?
Feeling good.
He's
Easy peasy.
He's motivated. He's motivated. Okay, cool. So now, right down for us. Perfect, relax. So you can see it's already bulky, so I don't want to make it too much wider. But he does have a beard, so I'd rather him to be able to see it a little more. To the left a little, maybe. So I'm going to build it up just a little on the edge here of the jaw.
Guys, this is Radius that we are using. People are asking what product. This one will help stimulate collagen building, and the results will last about 12 to 18 months.
And the good thing about it, it has more structure. So you can really get a lot of building out of the jaw. Like you can actually build it out nicely and
see the
see it.
difference.
You see already?
Yeah, you can really see
And
it.
then look at that sculpting here. That looks perfect actually. That's really good. And then what I'm gonna do
Guys, our patient will not have any downtime. He's ready to go out right after this.
Oh, yeah. Yeah,
People
he's
ask-
already planning some drinks.
Mm-hmm.
He's ready. Bite down a second so I can see. Awesome. Relax. Perfect. As far as we haven't heard from Craig yet. He typically is on every live. He is. That's what I was saying to you. I wanted you to know. 'Cause usually Craig gets on
So let's see,
there.
when will we be in New York? They probably want some fillers.
So,
Guys, end of the month,
Let them know end of August.
end of August, we're gonna be there. Send us a DM, full name, email, phone number.
Okay.
Let us know that you want us to come see you in New York, and we'll get you an appointment.
And we will be announcing that really soon. So again, with Chica is very little. He doesn't need a lot. We're gonna go into very meticulous placement with him. Perfect. I know.
Can we use PRP to fill in a beard?
You know, you can actually. Typically, I like to combine it with Latisse. So they have a whole protocol, you guys, on how to grow your beard and eyebrows. If you need even your hairline, frontal hairline, let me know. And we can give you our protocol. You can use PRP and ACell injections as well. I know that crunching is crazy. So I don't want to go too much for him. I just like the subtle amount of his cheek. I don't want him to look overdone. I want to keep that sculpted look.
How do you know that you're not injecting into an artery or vein?
Understanding of anatomy is really important. I was a skin cancer surgeon before, so I know where to go. Also, slow injection decreases your risk of really any issues, big issues. We're also on a very safe area. Now you can do what someone says, again, what I said before, aspiration doesn't really work that great. Unfortunately, to really prevent any issues. Let's see. That's really good. What do you guys think? Rosa, when she gives the
Rosa likes it.
Rosa's like,
I'm itching to see it.
He's itching to see it, Dr. Arsh.
I know, it's coming. He's gonna get the Emma reveal right after the lips. We're almost there. I have half syringe left and I'm gonna decide what to do. I haven't decided where I want to place yet. Because I want to do a little bit more cheek height. Just a little. I don't want, again, no artificialness, but radius goes down a little on the cheek, so you need to make it kind of a little kind of overdone. I hate to say that word. Right when it's done, so you can see the height there.
How do you choose what filler to use for your patients?
Well, that's based on how long you've used them and what look you're going for. Switch with me, I'm gonna hold here. You hold here. So with this one, we want structure, we want lift. That's why we're using this one. You can see that sculpting out. I'm gonna give a little more projection to the chin. I feel really numb. Right there. Chin in some people requires more than you would think. And I don't want his jaw. What is that side there? Yeah, that's really good. Right down again into both sides. Okay, turn me just a little. Do a little bit more at the 90-degree angle here. Alright, now let's go lip. We're gonna give him an ice pack. This is the hardest part. So look at you guys, he has a really good smile, okay? A big smile, but he has a beard, and I like to kind of just enhance everything. His lip itself, volume, I think would be perfect. It's just gonna be like 20-30% more plump and shaped. So hold this and kiss the ice pack, and then we're just gonna define it. We're gonna use my favorite product for men in lips right now is Juvenile Velour. It's an amazing product. This is the Ferrari of fillers, you guys. So, you know, you look at cars, they're all sexy and beautiful. Some, you know, I would say Ferrari, Aston Martin, McLaren, one of the more beauties. This one is the beauty of fillers. Why? It is just made with a very specific technology that makes it very smooth, longevity, but you have to know how to drive it. Okay, it's very important. You can't just get in a car and drive it. This one, if you don't know how to drive, it's gonna move all over the place, and it's gonna be crash and burn. So I've been using this for a long time. I know exactly how to do it. So it's one of my favorite products for lip because it looks the most natural and will last a really long time. Okay, but you gotta know how to use it. So he already has a really nice shape. And the other thing too to notice is his lip is very compact. On the bottom, which he has volume, so this will give him more hydration. We don't want to go too lateral at all. We literally just want to do a couple pokes center, and that's it, because that's the way his lip is shaped. And see, we're just gonna keep defining, and you see how he's like a little chapped? This will actually give him hydration internally, because the HA, the hyaluronic in this, is very unique.
Are there any effects with the vaccine and fillers?
You know, every vaccine has the risk of causing an inflammatory response. Perfect. So with any filler, you guys, great. Let me come over here for a sec. You have to know that there's a chance that if you get a vaccine or any virus for that matter, whether it's actually getting sick, can cause you, now we're gonna go to the upper just a little, can cause you to get an inflammation. I'll tell you though, I've only seen it twice in this past year. And now I'm gonna do, this is our pillar technique, or some will call it the Russian lip technique. Just a little bit. Perfect. Okay, let's go to the other side. Ice again. No crashing and burning here.
No.
That's right. Okay, let's see. So you guys can see, take a look at the one side that's been done on the upper, and look at the upper on the other side, totally different, but look again, so subtle, right? And this is a male keyhole pout, but doesn't look pouty or unnatural, right? Especially for ethnicity, you have to be really careful. You don't want someone to change how they look. So again, we're gonna do...
We must have a lot of injectors today watching us.
Why?
A lot of people have asked, why don't you aspirate?
On the lip?
Because...
You can't aspirate the lip. It's impossible. Experience.
Right, and what causes fillers to migrate?
You know, typically it's when overly injected in movement areas, but also like the mouth and eyes, but also wrong product. Like this product, again, super soft, but you gotta know how to use it. Regular Juvederm Restylane, they're like Dippin' Dots. They have lots of particles in there. They can move. So I'm gonna do a little in the corner, just to kind of shape. I really like the shape here of his lip now. So I'm just gonna do a little at the border. So we're gonna make sure he naturally has one side that's a little higher. So I'm trying to get this one to come up a little bit more. There we go. And balance. Good. Amazing, you guys. A little more on the lower and the other, and we're done. See, you would think, you wouldn't even think to do his lip. I'm just gonna do a little on the edge. But look at the result of it. Do a little into the corner. Let's say look close for a second. That's perfect. And then again to that chin crease, just a little support there, so we balance out his new broad chin and to the corner of the mouth. Beautiful. All right. So now he gets to see. So
You ready?
What's the first step?
I'm ready.
What's the first step?
We're gonna flip the
I'm
camera.
gonna reveal. I'll clean you. Hold on.
And we're gonna let him see. We'll clean him off first.
Oh, he's gonna love it. He's been leading. Okay, so give him the phone. So you guys, Emer reveal. He's been Emerized. We're gonna give him the phone so he can take a look.
There we go.
Here we go. Take a look. Hold it up. Hold it up a little bit. There you go. And like this. There.
Oh wow.
Now, so what do you think?
I
Now,
love how you define the cheekbones.
Yeah, just a little, because I didn't want it to be too crazy.
Yeah, like I was worried about.
Yeah, just a little height
Yeah.
here. You want the lighting. This is why it's actually cool to have these lights, because you can see sort of the shadowing, the lights on each side. You want the light to hit at a very specific angle on a guy. On women, we go a little more lateral, a little more medial. Here we want it right there, the lateral canthus.
And I can see the
Jawline.
jawline with the beard.
Yeah, which is great. Look at it forward straight and kind of bite down a little bit. You can see, or even go like this. There. So you can see where it kind of zoomed in and come up a little higher so you can actually on an angle. There you go. And then turn the opposite way. See the other side.
Wow.
See the lighting and stuff. And then with the temples, no more hollowing. What do you think of the lips?
I love it.
Come in a little closer, look at the lips and chin. Amazing.
Amazing, yeah.
Doesn't even look done. And that's the thing, you guys, that's a syringe of allure. So now we're gonna change it, hold on, we're gonna give you the mirror. Because in the mirror, it looks different. Now, this will last a year to year and a half, you guys, which is amazing. So what do you think now?
Oh yeah, no, I just like this hollowing just was bothering me,
And you know, the thing
so
is
much
now with
better.
the lens too,
Yeah.
it just looks healthier, you know?
Oh,
With
yeah.
I have it, look, you can see the difference. Look at my hollowing. This is from doing all the lipo, you guys, right here. And then look at, now he has no hollowing, you see?
Yeah.
So that's facial sculpting, you guys, in all areas. This is more what I call anatomical sculpting. Cheek, jawline, chin, temple, and then we fine tune or finesse doing his lip and around his mouth. Under eye, you don't even really need to do under eye folds or any of the wrinkles. He doesn't have any because everything's now more lifted and more structured. So all right, let them pan, show the result. Is there anything else we need to answer, Jordan?
Well, people are really complimenting us.
Yeah, now he's ready to go out.
Oh, so good. Wow, it doesn't look overdone. It's
No, it
like-
looks like on the.
Just so natural,
I actually
yeah,
can't
natural.
wait to see the 90-degree change. All right, guys, thanks for joining on Filler Friday. Bye. Cool. So why don't you do your pictures and I'll do the Botox.